Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. Listen, it's springtime, it's summertime. This is the time of year when a lot of people are responding to a lot of things in the air and on the ground. You're at your kid's soccer practice, you're seeing them play soccer, and then all of a sudden you have a rash and your eyes start to water. So what is that and what's happening in your body? We're gonna talk about that right now. Seasonal allergies aren't really seasonal, meaning just one season. They are year-round. I get them, my wife gets them, even my daughter has a grass allergy. But if you have conditions like asthma, they may trigger an attack. You guys all know the feeling. Itchy eyes, runny nose, maybe even wheezing. As a parent, this can happen on your child's soccer field or due to a harmless in-house pet. It's not uncommon. But what are they? What are these allergies? Remember, the air you breathe is full of molecules. Some of these molecules, let's call them allergens, stimulate an inflammatory response in your upper airway, causing sneezing and redness in your eyes. And at times, redness on your skin. But what's really going on with these allergies? Well, as that allergen comes into contact with your airway cell or any other epithelial cell, that airway cell releases molecules called cytokines, which activate the inflammatory white blood cells who end up producing an antibody called IgE. This antibody binds to cells called basophils and mast cells. These cells then release histamine, proteases, and other inflammatory mediators that lead to swelling, vascular leakage, mucosal edema, and more release of molecules. That's essentially what's happening in your eyes, in your skin, and in your lung. So what do we do to treat these allergies? Well, to slow this process and improve symptoms, you can take an antihistamine. Personally, I like to use Zyrtec or I'll use Xyzal. They're highly selective antihistamines. Because they're so selective in their binding, you may not get the sedating or sleepy side effects that you get with other antihistamines like Benadryl. Again, when you're working late nights in the ICU like I am, you don't really want to take Benadryl because you can't fall asleep when you're taking care of patients who may not be doing so well. Again, the binding of this molecule in Zyrtec or in Xyzal inhibits those allergic symptoms from actually happening, and your eyes stop watering and your nose stops running and you're able to run through the grass risk-free. Thanks for joining me.